Welcome to the Dr. Franken Steve Podcast with your host, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is the Dr. Franken Steve Podcast. I'm your host, Frank Williams, and this is Dr. Steven Snodgrass, MD, FACS. We're going to be covering something that's been around for a while. I think it's been popular since about 2022, but it's really starting to hit now in all the social media feeds, as well as a lot of news agencies and quasi-news agencies are actually starting to put out the things like magic mushrooms or psychedelics, and so that's what we're going to be covering today, specifically for the how is it pronounced, Steve?
Psilocybin.
Psilocybin, yes. Which is a product of, or some people call them psychedelic mushrooms, which are now very popular as far as moms, people and their anxiety, different areas, and how they're microdosing. So we just figured we'd put out some information. This is from both the National Institute on Drug Abuse, the NIH. Steve's going to cover from the medical viewpoint. I'll kind of touch on it. I'm not a lawyer. I'm retired law enforcement, but also from kind of what the things to watch out for from maybe a law enforcement perspective. So without further ado, I'm going to let Steve go right into.
Thank you. First of all, I am post-op from my second surgery, so I just dressed for comfort today.
Yeah.
So
Bowling accident.
I'm glad the fashion police is no longer out there. They may get me today. But anyway, that being said, I just dressed for comfort. So there we are. But this is about microdosing mushrooms.
Mm-hmm.
And if you look at what's being said out there, and it's like, and you know, I'm a huge Rolling Stones fan.
Mm-hmm.
And it's just like,
geriatric.
It goes back to the whole thing of just like, this is Mother's Little Helper from that song a long time ago. And I think, yes, I can understand why that is applicable, but I'm going to say there's another Rolling Stones song that is even more applicable, and it's called Play with Fire. And I think that's kind of where this is because we're dealing with so many unknown variables in all this. We don't know. And so when people who are, even if you're of medical background or whatever you are, you're talking about giving yourself a smaller dose than what is normally required to achieve the high or whatever it is. So it's like, you know, a 10th or a 20th of what's there. But there's so many different problems with all this. First of all, psilocybin, it's a psychedelic, a chemical compound that's in certain kinds of mushrooms. And when it's ingested, it's broken down into its active metabolite called, some people call it psilocin or psilocin, whatever. It's a serotonin like agonist, and serotonin is the quote feel good unquote hormone. And so that's, I think, a lot of the reasoning why people think like, this is going to get me through the day. It's going to make me more productive. It's going to make me more focused, that sort of thing. So they're dosing themselves on something that has not even been any way approved, any way, shape, or form. It's still a Schedule 1
drug
substance, and so it's a federal law to possess it or take it. And you know, one of the things that I find amazing, I've had a discussion with a few people that are like half my age, you know, and they're kind of looking at me just like, well, you're just some old man, and of course you're going to feel that. And I was like, well, no, it's like, I don't have a problem if you want to, you know, if you want to microdose something or whatever, and that's your business. I'm not sitting there trying to tell you how to run your life, but when you microdose and then you start driving and you're out in public,
operating heavy equipment, carrying a firearm, first responder, you know, flying a plane, any of that.
Then it starts to be like, well, you know what? It kind of is my business, because you have no idea what's going to happen as a result of this. And
It can become a slippery slope.
oh yeah.
If you think you need it, and maybe you need to microdose a little more, and then, but we'll get into that. So.
Oh yeah, but then, this hits the receptors for this are on the prefrontal cortex, which is the area of the brain that basically forms your personality, your thought processes of just going like immediately what is happening to you and how do I respond or how do I react. And so that is the area of the brain where this is centered. So given that, it certainly is something that we need to discuss, because it's a psychedelic hallucinogenic drug. And if you are self-dosing or microdosing it, I read where like there can be a field of mushrooms, and one mushroom that sits right next to the next one beside it, the one can have like 20 times the potency of the one sitting next to it. So you don't know what you're getting. And so I think that's a major problem.
It is, because these type of mushrooms are found in about every continent.
Yes. And not to mention, you go digging around, you get a poisonous one for that matter. But, they're trying to say like, well, there's capsules now. There's these dried edibles, if you will. There's fresh edibles.
And my opinion on this, as I've said many times, not if there's anything wrong. So if you people are into the CBD world, don't be sending me emails, because you'll get the biggest rejection, which is my trash pile. But unless you've got something concrete to say, or something that can help continue the conversation. And I don't mind you disagreeing. I love that. But I want to know facts, figures, all those things. But as we've said in previous podcasts, when it comes to inks, when it comes to a lot of different type of products, materials, especially if anything you ingest or eat, or that skincare goes on your body, who is regulating this? What are the studies actual studies, double blind tests, whatever you want to call them, that show where's the medical research to show the proper dosage by weight, by height, by characteristic or issue, if they have mental health issues, if they have health issues, where's the drug interactions? And I know that's things that are being worked on, because there are several states that are actually funding studies in this, and that's great, because that's what needs to be done. But where are all the regulations? Because as far as I know, it was like the CBD craze, and I'll come back to that as I go a long way around my little tangent here, is that at one time, Steve and I, since we deal with health technology and the arts and all that, we looked at this and was approached and said, oh, you guys should sell the CBDs, the gummies, the oils, this and that. And so about half dozen different companies were in touch with us. And I said, okay, send me your lab results. Not only send to me your lab results so Steve can look at them, I can look at them, and his wife, who's a pharmacist, can look them over, as we've asked her to do before. But also I want to know for that type, who certifies that lab? Where's that lab? So are they USDA or are they FDA? Who is doing that? Because anybody can say, oh, we do this and it's all, we have the strictest standards and we meet this criteria and this criteria. Well, then prove it. Have your stuff tested at a lab. And just show us these things. But I would venture to say that I'm going to assume that the majority of those are not under that type of scrutiny.
No, and I think that's one of the reasons it still has the Schedule 1 classification, because there's no, at this stage, there's no medical use for it that in treatment, and is not safely accepted even under medical supervision. And so I do want people to understand that I think, the bigger drug companies, I think Johnson & Johnson is one of the ones especially involved in doing some research on this. So it's not that we're closed-minded and just saying like there's absolutely positively no use for this and there never will be. We're not saying that.
No,
we're just saying like there's a trend of people microdosing themselves, and there's no set structure. Number one, you don't know what you're getting, and then to try to dose based on that, you just don't know where you are.
Right.
And again, if you want to take some of that stuff, go lay down in the floor or whatever you're going to do, fine. I don't care. But when you start talking about, well, I microdosed and I've got to go pick up my kid from school, you may go pick up yours while I'm there. I mean, I think there's going to be some catastrophes because of this, in my opinion. I mean, I think it's just basically you're still driving under the influence.
Yes. Well, that's why it's a Schedule 1. There's only a couple states that have technically legalized, and states that have what we call decriminalized, and you can find a lot of those on like the National Institute for Health, like NIH and all that. You can find it through the Drug Enforcement Bureaus. You can find it through the DEA's websites. A lot of those have all the up-to-date information on either where it's legal, which hardly anywhere, where they're putting out funding right now for research, and what states have either decriminalized it, like if you're at your house doing it or something. But if you get called out somewhere, you're still under, under a drug classification that can get you in some serious trouble, depending on your state or your local municipalities, ordinances and stuff that they have set up for that. So we're not saying because that you shouldn't do it, that you can't do it. We're just saying you need to be responsible. Always check with a physician. That does not mean a physician assistant or a nurse practitioner. That means an actual RD, which that is a term Steve gave me, which means real doctor, which is an MD or a DO. And make sure, because right now, as I said a little earlier, and I'm not the medical professional, Steve is, but I'm telling you, you have to, and I'm the caregiver again for my 95-year-old father-in-law who's going to be 96, but we have to watch, because there's been a couple times when somebody's wanted to give him something at the doctor's office, and I said, well, he takes this, will this affect it? I never thought about that. Yeah, we have to knock the dose in half from what we were going to give him, or maybe we'll find something else in its place. And as Steve has always taught me, for well over a decade now, for about 15 years, you have to be your own advocate. And I understand people are stressed. Look at the socioeconomic times that we're in. There are clubs popping up all over the country and in some parts of the world, like for moms and mushrooms. I don't know what the specific names are, but I know there are a lot of clubs and people pushing it. Some of the hot topics on some of the news stations and the news outlets. However, you just have to be careful, because just like you get things here in the U.S. that are dosed with fentanyl, and I'm not getting on that kick because we're not talking about fentanyl right now, but you don't know what could be inside of this if it's not a regulated, product. Like people say, oh, I get the gummies, they're already done. They do all that, so I don't have to worry about it. It's got the recommended dose. Well, where did they get that recommended dose from? Who was supplying? So you can tell Steve and I are kind of, what's the word I'm looking for? Anal retentive. When it comes to research and knowing things, because it's like the old little commercials on Saturday morning. Knowledge is power. And the more you know, the better off you're going to be. Because while it may help you with issues that you're having, it's still a hallucinogen. So that thing is going to make you possibly see things, feel things, hear things. And just live in an alternate reality, even if it's for a short time. And when it says, and I've read articles where it says, well, it really brings me back into peace and focus, and then I can deal with my family and my kids, you need to be considered that, because I will tell you what, as a law enforcement officer, if I came to your house and you were kind of out of it, and you said, oh, I grew those, I'm allowed to grow them, and I found that you were a little out there, and then you got tested, you got a good chance that Children's Services coming and removing your kids from your home for a short time. And I'm not trying to scare you, I'm just telling you the realities and the facts, because you're not in control at that point to be able to give supervision to young children. So I'm just telling people, as Steve does on everything, we don't say we're for or against. If we're against, you're going to know it pretty good, pretty well. Yeah. But we just think you have to be cautious, so we want to put out and continue to put out this information so that you can make the most informed choice. But the bottom line, for the most part, yes, it's a Schedule I drug, so it is illegal, but there are nuances within the laws and the way it's set. So like if you grew it in a state that it's not criminalized for that, or the criminal penalties are actually dropped down to nothing more than a $10 fine or something, that's different. But you need to be checking all that out. Know that, along with, I will reiterate again, and then let it get back to Steve, but is the fact that we hope and want to push lawmakers and oversight in this industry, not just for research, but for rules and regulations on how these things should be. And a lot of people say, well, they wouldn't be allowed to sell it. You know, you couldn't get the gummies, you couldn't get the capsules if they weren't legal, if they weren't allowed to do it. That's not necessarily true. You know, when you start depending on what people say, everybody's an expert like a keyboard warrior. But when you get down to it, again, I've won a lot of debates that I you know, have been in situations. I was a union president for almost 10 years and used to do a lot of contracts. One of the things, as I said, you just got to know your stuff inside and out. It doesn't mean you're a genius. It just means you have to put the time in to research it and know it. Don't just go off because somebody says, oh, you know how I get through the day, sweetie? That's my female imitation voice, because I live in a house full of females. I go ahead and I've started microdosing, and I'm telling you, it just does wonders for me. But you don't know what that person's underlying health problems are or anything else. They start microdosing. You see them butt naked on top of the roof dancing around or something.
Normal behavior.
Yeah. Yeah.
But you know, the thing that I was looking at is that in 2023, the FDA established some research guidelines in regards to mushrooms and psilocybin, and saying, like, you know, there are some areas where this shows promise, but it's still investigational, if you will. And so they're looking at things like PTSD, alcoholism, smoking cessation, depression, things like that. So, I mean, again, I just don't want people to think like these two guys are so boring. You know, what kind of lives do they lead? Because, you know, they just keep cautioning us to do this and not do this. All we're doing is trying to relay our experiences in, you know, in your world as a law enforcement military veteran, and mine as a physician. And so we're just trying to tell you, warn you, give you the background on all this, and you don't have to take our word for it. No. But if you do look it up, that's great, because it shows you're looking it up. That's but right. You know, and during some of my research on all this, it just reminds me, I was watching a psychiatrist talk about the psilocybin and that sort of thing, and he went off on this, I'm not going to call it a tangent, but it was like talking about the wonderful mystical experience that you can have with this drug and all this kind of stuff. And I'm like, it just reminds me of what you said about the R&D. And this is where, you know, that term came from, is that I was in surgery residency, and they called us down to the emergency room for, you know, a gunshot wound to the abdomen. And so I was on call, and I went down there, and, you know, they had what's called on a mask suit, military anti-shock trousers or whatever it is. And that was fully blown up. And the guy's blood pressure, we got enough blood in him and that sort of thing to where we felt like basically it's time, you know, we're going to have to look and see what's broken here. But we couldn't deflate it, because it kind of looked like the Michelin tire man. He's all blown up and everything. And this is like what was keeping him alive. So anyway, we started deflating, and you deflate a little piece at a time, here and there. Section. Yeah, and so finally we got to the part where his abdomen, you know, we could open up and see what was going on. And he had been shot in the abdomen with a shotgun, and all his intestines were hanging out. And they just said to me, they said, "What do you think?" And I said, "I think he needs an RD." And they just said, "What's that?" And I said, "A real doctor." I said, "So let's just get him prepped and take him to surgery right now." And so that was my interpretation of it. And I think
so that's where it came from.
That's where it came from. But I think it's pretty applicable. you know, because it's like, we're not going to talk about giving you some sort of pill, or we're not going to do this, or, I mean, like, you know, you're going to have to go to surgery, or you're going to take the celestial discharge, I call it, you know, so that's that. And you as a police officer, I just think this would be an interesting question. Let's just say I'm driving, and then like I've had my microdose, and then I just start swerving or whatever, and then you pull me over because you think that's erratic driving, and you say like, sir, what's going on? And I just say like, well, officer, I'm just having a mystical experience.
I'm going to say, you know, most states, the statutes are, it doesn't say driving under the influence of alcohol. It's driving under the influence. You could be huffing some paint cans. That's still driving under the influence. You're still going to get in trouble for it, you know.
And I think, I really think there's a lot of people that don't realize that when they think like a DUI or DWI or whatever,
that's not what the
they
state
associate it with alcohol only.
No, that could be any type of drugs or chemicals that alter you. Like I said, who would think that you're driving under the influence of somebody's, and for those who don't know, huffings were, it's kind of like crackheads. Huffers will buy cans of paint and snort them up their nose to get the high when it goes into their brains. And I've arrested several people on this over the years before I retired. And you can just tell when they got paint down their shirt, paint on their face there, and they're like, oh, the can exploded. Sure it did. As you're sitting there watching, you sniff one. But, you know, these people are whacked out. They get violent. They don't know what's going on. They're a lot of times nauseous. I won't go into, it's kind of gross, but if you pull somebody over, I would assume a lot of police officers are going to think, one, you're having a medical emergency. If you say, no, I don't drink, they're going to assume you have a medical emergency. You're either been sleeping, in which case they're going to, you know, check you out anyway. They're probably going to do some type of sobriety test. But most likely, if they find you have no, like, oh, this person's not on, you know, they've not had an alcoholic beverage, as they're referred to in law enforcement, they can still have you do tests. And if they have you do anything from urinalysis to, and I don't know if they show up on urinalysis currently, but in being in the system, which I'm assuming they would, but I don't know, so I won't say for sure. But if they do a blood test and all this, and then you go and say, yeah, well, I just did a couple, you know, little tablets of my mushrooms, the only thing I've had, they don't do anything like that. Then they're gonna let the court settle it, but they're gonna, most likely you're gonna be arrested for driving under the influence or impaired driving. All those things are the same thing. They can have absolutely everything to do with alcohol. They can have absolutely nothing to do with alcohol. And so I think you're right, Steve. I think that's important. A lot of people don't realize that, you know.
And one of the things that I saw where, I think it's Oregon and Colorado, I think there's some local areas where, you know, this is considered not to be illegal.
Yeah, and I think Oregon's just starting to do the legal dosage and all that, according to them.
And the Colorado State Police, I thought they really had a good line. They just said like, how you feel is how you drive. And I think that pretty much hits it on the head. And, you know, if you're having a mystical experience behind the wheel of a motor vehicle, I don't think that's going to be all that good. You know, it's just like they said, oh, these mushrooms have been in use since 450 BC, and then I think in Europe for the first time, like in 1799.
Yeah, they first came out here. I mean, the information and the concern about them first started happening around 1965 here in the U.S. From what I've read, for where they're looking at, you know, from the federal regulations. I know there was there was an act that was introduced 2 years ago, but it's still in the same stages currently where it was introduced. And the DEA, as I said, I looked that up. What is the DEA? And the DEA has confirmed to law firms and people, and I guess because of court cases maybe, that psychedelic mushroom the spores are not federally, let me say this right. The DEA confirmed that psychedelic mushroom spores are not, or rather are, let me say it again, they are federally legal prior to their germinization.
Oh, no.
No, I'm saying that's what they came back and said, but what does that mean? Basically, it means that I guess when they're real small, they haven't really, you know, to where the spores and stuff can spread and so.
You know, it's Well,
However, other than that, they are illegal, they say.
From Harvard Health, they concluded that there's no definitive evidence that microdosing is either safe or effective. And there was just the literature and the things that I looked at. It's just in no way should this be used in uncontrolled environments without medical supervision, because that's the bottom line. Because do I think that there's going to be a use for it? I absolutely do. I really believe that. And it's not like, again, we're not trying to stop progress here. It's just what we're trying to do is saying, like, look, you think that you are being safe by taking these micro doses, and you're not. And especially if you've got childcare involved or anything like that, you don't know. And so what we're trying to do is just prevent catastrophic accidents.
And they are working to try and get this into law where funding's more available from the government and from the states. I mean, that's why I was mentioning a little bit before. You got Congress that has the Breakthrough Therapies Act was introduced in 21 and 22. At current time, it's still sitting in a status where it's been introduced, which means it's just sitting there waiting to go to committees. So as it becomes more of a hot topic, which is starting to pop up to be, hopefully that will get some attention and get some people's feet on the fire and get them moving so that the oversight can be there. And because, like Steve said, for people with PTSD, people with certain mental disorders, people with anxiety, depression, whatever it may be, there may be some very legitimate uses and some health benefits to it. But just starting a craze where you're trying to just microdose and or self-dose, we just want you to be cautious and watch out for your family.
Since it's unregulated, I mean, there's really no easy way for users to know exactly what they're getting. And I just want to keep driving that point home, because the people that I spoke with who use this, they're just kind of like, well, what you're saying just doesn't make any sense, because we know exactly what we're getting. I said, okay, look at that package and then tell me exactly where that dose is. I mean, I want to know the exact dose. And they said, like, well, I kind of can give you that information. I said, kind of. I don't know what kind of means. And so again, it's one of those things. If what we're trying to do is, like, you don't know where you are in regards to potency, purity, and safety. And I was really pretty shocked by the fact that you could have a field of mushrooms and one's growing here and one's growing here, and this one over here can be exponentially more powerful than the one right next to it. So you don't know what you're getting.
No, and when people do these things, they don't realize a lot of times, because you're under the effects of it, your mood and your perceptions change. I mean, there's a lot of not just psychological effects. There's also a lot of physical effects that can happen during this. From what I've seen from the NIH and stuff, it can cause blood pressure issues, where you raise your blood pressure. It can cause nausea. There's all kinds of things, and that might be like any medicine. Maybe that goes away after a short time. You don't know that if it's not regulated, because there's not been tests to show that.
Well, think about it. What I wrote down, once you did, like, just basically a meta-analysis of everything, where you're just kind of going through all literature and you're taking salient points from each paper that you read and that sort of thing. So if you got an inaccurate dose of this, and I want you to think of it in these terms. Let's just say, for example, that the one thing I do want to say is, like, again, it's been in use for, they say, like, since 450 BC, and indigenous people use it and all that sort of thing. But indigenous people didn't have, like, minivans. So, if you're just around the campfire and you're dancing around and all that kind of stuff, and you're having your mystical experience, that's fine. But you get in your minivan, you drink your coffee, and you're on your cell phone, and you're trying to control like 5 or 6 kids in the back of that thing, there's a problem. Because think about that scenario, being in a minivan, having your coffee, being on the cell phone, and you've got a bunch of kids in the back. And here's some of the things that microdosing inaccurately can lead to. As you said, nausea, vomiting, muscle weakness, lack of coordination, hallucinations, inability to discern fantasy from reality, panic attacks, or a complete psychotic, schizophrenic break. And now you're behind the wheel with a bunch of kids.
And let me clear something up for legal purposes. Steve is saying minivan, that could be an SUV, since a lot of people don't drive minivans anymore. That was like the 80s. But
all I know is it like when my kids were
but they're SUVs, and I know I had several minivans with the kids and stuff, but a lot of people drive, women, guys, whatever, drive soccer moms, soccer dads. We're going to keep this DEI. But that's even worse. Minivans are somewhat, they're not very heavy minivans. They're not, they're kind of lightweight. But if you get behind the van of a big Chevy Suburban, like I drive, that's like a tank coming down the road. Yeah. Or you get in a big Ford Explorer, or Expedition, rather. Ford Explorers have shrunk down over the years. Escalade, whatever it might be, I don't care what you're driving. If you got some big old vehicle like that, that's an awful dangerous to be, not in full control of your faculties.
Yeah, and when my kids were growing up, it was just like everybody had. It's like you could put like, I don't know.
Oh, yeah. I loved them. You could put
dogs, barbecue.
Yeah, they seat about 7 or 8 depending. Plus you got room in the back for groceries. Got your little thing on top to put extra stuff on.
Oh yeah, I mean it's really convenient, right? And that's, I think, a lot.
Did all doctors have minivans?
No, I don't think so. It just like there's a lot of people that say like,
did your minivan have custom plates? Dr. Steve.
They would be upset because just like, I pulled up in front of my guy friends and I'm driving a minivan. It just takes away that street.
I told you, Dr. Cass and I used to do that. I had a green minivan. He had a red one. He's one of my students and a good friend of ours. We would go watch videos we'd go watch movies, like action movies, but the only time we could get away was like on a Friday night at the 11:30 or midnight showing. So it was always 2 old guys pulling up each in a minivan, getting out to watch a Rambo or something.
Yeah. And you're ready for Christmas with one being red, one being green.
Yeah.
You're good. But the other thing too is the thing about tolerance. And tolerance just means that you have to take more of the drug to get the same effect. So there can be like a psychological tolerance, there can be a physiological tolerance, and this can be like, this drug is kind of like in the same category as like mescaline, peyote, LSD, that sort of thing. So there can be like cross tolerances.
Yeah.
And so it's going to require more of a dose to get the same effect. And then when you start adding to your microdose to get the same effect, you may cross the threshold of now you are suspect to one of those complications that we mentioned. And then where this really gets to be frightful is like you mentioned it, but you can have an underlying physical condition, you can have an underlying mental condition that has not been diagnosed. And I think they especially mentioned like depression and bipolar disorder, and hypertension and cardiovascular disease, heart disease. And you're taking this medication. This really is a medication if you get right down to it. You're taking this drug, medication, whatever you want to call it. You're microdosing yourself, and then like all of a sudden now you've unmasked something that was there. Instead of being discovered during a routine physical exam and lab tests and things like that, you've discovered it on the highway. And that is a potential for disaster, obviously.
And I was reading again on the NIH that one of the good things is it doesn't seem to lead to addiction, this drug. Though some people may be, hooked for other reasons other than, drugs. But there is a disorder, I think it's hallucinogen persisting perception disorder, HPPD. Look it up if you have time. It's more commonly known as flashbacks. So, and these can occur suddenly, come out of nowhere, and they can persist for years from psychedelics like these mushrooms. If you're not dosed right, it's not interacting with your body and maybe other medication stuff right. And so what happens is when you have these flashbacks, whatever hallucinations you had during that period when you were on your high or at your set, which is the time frame that it's kicked in and it's working, those will come back and give you a flashback when you're not doing that, and when you're perfectly, I don't know, for a lack of a better word, when you're not stoned on them or something, or you're not up on them. So that's something else that they are researching, the government right now, and not a lot, but there are several medical research organizations that are trying. But it just depends on where the grant monies come from and where the research monies come from, because they're kind of limited in scope right now. But that's something that you need to be aware of, that you might see purple dinosaurs and Barney, and my kids were little. You might see things and be experiencing things, anxiety, paranoia, any of that, as Steve was talking about earlier, because those are side effects, or can be. I'm not saying they are, but they can be potential side effects. And then those things can pop up, down the line. Maybe you haven't taken one in, a week or something. All of a sudden, you're seeing things you shouldn't be seeing and experiencing things. Those could be some of the side effects on top of everything else that Steve's talking about. Again, that's called HPPD.
And the thing is, we don't condone it, we don't condemn it, and we do see the potential merit of it. And then it's because how a lot of things are discovered. I mean, there's a lot of things that originally were looked upon as being very detrimental, but in under controlled circumstances, they were found to be extremely helpful and turned into medications.
Right.
Which that's all about progress, growth, and just moving in history. Just look at the way some of these drugs have been discovered. So we're not against that part of it. It's just, I guess it's just much better if you're going to do this, I would say, to just like go back. This is going to date me, but whatever. Get you a black light poster, put on a little Hendrix or something, but don't
talk to a medical professional, like I said, because there are no current studies, unless I missed them, for pregnant women. That's whether maybe unless you have something that shows the effects of either on the mother or the unborn fetus, on the baby. So I would say don't do it a period during that time, because women have all kinds of hormonal issues and stuff during that period. But you wouldn't want to do something that's going to affect you or the baby that you want to have. So
I would think this would I have not really studied the aspect of it in regards to pregnancy and things like that, but I would think it would be a definite no-no.
Well, yeah, and they're saying, from what I've seen, they're saying that there is no data currently available for that, but just consult your physician and make sure. And the best way to be cautious is just not to do it while you're pregnant.
Yeah. And there's several studies that are out there, and one in particular, they tested for mood, cognition, several different tests. They did find, there were some EEG changes, but they weren't statistically significant. And but the conclusion of the study was rather than enhanced preparedness and cognition, they described and concluded that there was impairment.
So, well, and you and I have talked about this, and when people say, and I'm not knocking anybody because you believe what you believe, okay, we'll pick it like the 60s, free love, whatever. But there are, from what I'm reading in certain articles and certain, I won't say, they're major news outlets, major news stations and stuff, when they did some of their interviews and talked to people, it was like, well, this helped to bring the parent or the mom back into, being present and aware, and just making them a better person when they're around their family. And so that's some of the big push. but there really wasn't a lot of hard follow-up questions to that because, again, uh, if you're in charge of any small children, you shouldn't be, and I'm just going to tell you that my personal opinion on it, even though we're giving you all the facts and where to look things up, like I said, and Steve is from a medical standpoint, is if you've got young children and you're having issues like that where you feel you need to do something like that, it isn't like taking an herbal tea. You need to go consult that physician or a physician, medical professional, mental health professional, anywhere like that, whether it's Christian counseling, whatever it might be, secular counseling for you, but you need to do that so that you are not doing something that could potentially harm you or your family. And we're not trying to be doom and gloom, as Steve said, because I think there are going to be changes to the law and the research as they come out with it, and it may even get expedited approval once they figure this out and get it going. How to do it properly, dose it, and make sure what works and what doesn't work. There's a lot of unknowns for as long as it's been around. So, like I said, since 1965 is when the U.S. government first started taking notice, or that's what they say anyway. Could have been from the 20s or 30s, but when the government said they first started taking notice and started trying to introduce and look at legislation for it, and you can see how far we've gotten in the last 60 years. But you just need to be careful. So I'm a big advocate, as everyone knows, family and kids. So my thing is, if there's something that doesn't feel right, or you feel like you needed that little help to get you through, and I know we hear this and we've read it, well, it's better than taking alcohol and drugs like pills, or something, or some type of substance. And I agree with you there. But there's a season for everything, and if that's a season you're going through that you need help, it's better that you get some type of prescribed drug from a qualified physician, MD, DO, rather than trying to supplement that onto the latest craze. And that's all I'm going to say on that.
Well, I think to your point is you have to sit down and ask yourself, why am I taking it? Why am I taking it? And I can honestly say I've never been really a big drinker or anything like that. I've never said or felt like I need a drink. I've never felt like that. I need a drink.
Like the old cowboy shows.
Yeah.
Give me a shot.
I've never felt like that. And so I think that you have to sit down and ask yourself why you're doing it. And those are hard questions and maybe even harder answers, but they need to be posed to you.
Absolutely.
And at some point, by the way, this is like, well, tomorrow will be my 10-year anniversary of no alcohol. So and the reason that I did that is because I had the wonderful experience of basically being forced off the road on my bicycle and hit a patch of gravel, and then.
But you weren't drinking while you were riding.
I was not drinking. No, I was.
I want to clear that up because it's not like I want to be.
I was like, that could have been a time you say after that you could probably say I need a drink.
Yeah.
But it was like I was laying in this ditch and.
I remember.
And broke my hip, broke a rib, had all the skin taken off my arm, and I actually saw the road rash. I saw a vein sticking out, and it was really profusely bleeding. And I took off my jersey and wrapped my arm, and a guy stopped during the accident, and he looked at me and he started to pass out. So I had to get him situated, sit down, and I thought well, as long as I'm I'm standing up and I really don't feel any pain. I mean, I got this badly bleeding arm, and I can control that. I know what to do with that. But then I tried to climb out of the ditch, and I could hear the bones crack together. And I said, well, I'm going to say that's broken. And so I ended up, I had this kid take me to the emergency room in a pickup truck. I'm getting way off base here, but it's kind of fun to to remember it on my 10th year anniversary kind of thing.
Yeah.
And but I can remember I said, don't call an ambulance. I don't want anybody to take care of me but myself, because doctors make terrible patients. But I said, I got this under control. So this kid takes me to the emergency room in a pickup. And let me tell you, every bounce.
Oh, you felt.
Oh, yeah. It's kind of like, I want my mommy kind of thing. It was kind of like along that, because I was holding on. Because he's like, you all right back there? And I was holding on. He had a bunch of, like, a big pile of dirty rags. And I was hanging onto those rags for dear life. I was just going like, just get me to that ER, man. And finally got there. But I decided, said like, well, this is one of those kind of injuries. It's going to take a while to get back from. I said, so I can either like drink single malt scotch and take opioids. I could go that route to where you just like completely just numb yourself, or I can kind of suck it up here for a few days. And I put myself on an exercise program that was really horrible to do, but I worked around it. And I just said, like, I'm just not going to drink at all because I'm really susceptible now. I'm really, and I think that's one of the reasons I want to bring this up too, is that when you ask yourself why you're doing something, it's like, I could totally justify just like, I'm going to take some scotch and some opioids and I'm going somewhere else in my mind. Because the pain was pretty severe, actually. But I just said like, no, we're going to work through it. And after about the second or third day, I was really pretty functional, all things considered. And I said, well, I've made it this far. I said, let's just see what happens if I don't drink anything at all. And I've gone, it'll be 10 years tomorrow. And it's just like, I've noticed the biggest difference, like if you're out in a social situation, anyway, you notice things like when other people are drinking and you're not. And I just feel like
it can be quite the show.
yeah, it can. So I kind of feel,
especially down in Nashville.
Yes, absolutely. And so I kind of feel better that I don't do that anymore. But it's kind of related to it all, and the fact that why do you feel you have to mentally dissociate yourself? And so I think those are good questions. But for me, in closing all of this, is that again, we just don't want somebody microdosing themselves when they have no clue of what they're actually getting. And then especially when they do it, they go out in public and they're driving or they're taking care of their kids or someone else's kids or something like that. There's other things to consider, other people to consider.
What affects it, what other drug interactions you don't realize. Yeah.
So there's a lot of negatives on this. And eventually, I think this will all be legalized.
Right.
And it will be put to use, it will be regulated, and there will be a place for it. I really believe
it'll become, what's the two words?
Usual and customary.
That's right.
I believe so. And I believe that for the conditions that they're talking about, I think that, the PTSD is so real.
Oh, yes.
And I think that depression, substance abuse like alcohol, fentanyl, opioids, all those kinds of things. I think there's going to be a place for all of this to be used in treatment to make people better, but you just can't treat yourself.
No. Nope.
And that's all I had to say.
That's great. Well, we hope you got some good information. We hope you enjoyed it. We look forward to our next podcast with you. Keep sending in your emails and comments. We look forward to them. And other than that, stay safe and be healthy.
Thank you.
Thanks for listening to the Dr. Franken Steve Podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.